Hey, Alpha Nurses, I'm Licensure from AlphaNurseGuide.com. This is 25 practice NCLEX questions. Without the way, let's get started.
A client undergoes surgery to repair lung injuries. Post-operative prescriptions include the transfusion of 1 unit of packed red blood cells at a rate of 60 milliliters per hour. How long will this transfusion take to infuse? 1. 2 hours. 2. 4 hours. 3. 6 hours. 4. 8 hours. The correct answer is 2. 1 unit of packed red blood cells is about 250 milliliters. If the blood is delivered at a rate of 60 milliliters per hour, it will take about 4 hours to infuse the entire unit. The transfusion of a single unit of packed red blood cells should not exceed 4 hours to prevent the growth of bacteria and minimize the risk of septicemia. For a client with rib fractures and a pneumothorax, the physician prescribes morphine sulfate, 1 to 2 milligrams per hour, given IV is needed for pain. The nursing care goal is to provide adequate pain control so that the client can breathe effectively. Which of the following outcomes would indicate successful achievement of this goal? 1. Pain rating of 0 on a scale of 0 to 10 by the client. 2. Decreased client anxiety. 3. Respiratory rate of 26 breaths per minute. 4. PaO2 of 70. The correct answer is 1. If the client reports no pain, then the objective of adequate pain relief has been met. Decreased anxiety is not related only to pain control. It could also be related to other factors. A respiratory rate of 26 breaths per minute is not within normal limits, nor is the PaO2 of 70, but these values are not measures of pain relief. Which of the following findings would suggest pneumothorax in a trauma victim? 1. Pronounced crackles. 2. Inspiratory wheezing. 3. Dullness on percussion. 4. Absent breath sounds. The correct answer is 4. Pneumothorax means that the lung has collapsed and is not functioning. The nurse will hear no sounds of air movement on auscultation. Movement of air through mucus produces crackles. Wheezing occurs when airways become obstructed. Dullness on percussion indicates increased density of lung tissue, usually caused by accumulation of fluid. A client who is recovering from chest trauma is to be discharged home with a chest tube drainage system intact. The nurse should instruct the client to call the physician for which of the following? 1. Respiratory rate greater than 16 breaths per minute. 2. Continuous bubbling in the water-sealed chamber. 3. Fluid in the chest tube. 4. Fluctuation of fluid in the water-sealed chamber. The correct answer is 2. Continuous bubbling in the water-sealed chamber indicates a leak in the system, and the client needs to be instructed to notify the physician if continuous bubbling occurs. A respiratory rate of more than 16 breaths per minute may not be unusual and does not necessarily mean that the client should notify the physician. Fluid in the chest tube is expected, as is fluctuation of the fluid in the water-sealed chamber. A client with rib fractures and a pneumothorax has a chest tube inserted that is connected to a water-sealed chest tube drainage system. The nurse notes that the fluid in the water-sealed column is fluctuating with each breath that the client takes. What is the significance of this fluctuation? 1. An obstruction is present in the chest tube. 2. The client is developing subcutaneous emphysema. 3. The chest tube system is functioning properly. 4. There's a leak in the chest tube system. The correct answer is 3. Fluctuation of fluid in the water-sealed column with respirations indicates that the system is functioning properly. If an obstruction were present in the chest tube, fluid fluctuation would be absent. Subcutaneous emphysema occurs when air pockets can be palpated beneath the client's skin around the chest tube insertion site. A leak in the system is indicated when continuous bubbling occurs in the water-sealed column. A young adult is admitted to the emergency department after an automobile accident. The client has severe pain in the right chest where there was an impact on the steering wheel. Which is the primary client goal at this time? 1. Reduce the client's anxiety. 2. Maintain adequate oxygenation. 3. Decrease chest pain. 4. Maintain adequate circulating volume. The correct answer is 2. Blunt chest trauma may lead to respiratory failure, and maintenance of adequate oxygenation is a priority for the client. Decreasing the client's anxiety is related to maintaining effective respirations and oxygenation. Although pain is distressing to the client and can increase anxiety and decrease respiratory effectiveness, pain control is secondary to maintaining oxygenation. Maintaining adequate circulatory volume is also secondary to maintaining adequate oxygenation. A nurse is to administer 10 milligrams of morphine sulfate to a client with 3 fractured ribs. The available concentration for this drug is 15 milligrams per milliliter. How many milliliters should the nurse administer? Round to 1 decimal point. Blank ml. The correct answer is 0.7 milliliters. The formula is 10 milligrams over x ml multiplied by 15 milligrams over 1 milliliter. You cross multiply, and you get 15x equal to 10. You divide by 15 on both sides. X equal to 0.666, and then you round to 0.7 milliliters. A nurse should interpret which of the following as an early sign of attention pneumothorax in a client with chest trauma? 1. Diminished bilateral breath sounds. 2. Muffled heart sounds. 3. Respiratory distress. 4. Tracheal deviation. The correct answer is 3. Respiratory distress or arrest is a universal finding of attention pneumothorax. Unilateral, diminished, or absent breath sounds is a common finding. Tracheal deviation is an inconsistent and late finding. Muffled heart sounds are suggestive of pericardial tamponade. The nurse is preparing to assist with the removal of a chest tube. Which of the following is appropriate at the site from which the chest tube is removed? 1. Adhesive strip. 2. Petroleum gauze. 3. 4x4 gauze with antibiotic ointment. 4. No dressing is necessary. The correct answer is 2. Gauze saturated with petroleum is placed over the site to make an airtight seal to prevent air leakage during the healing process. Dressings with antibiotic ointment or adhesives are not used. Which of the following should be readily available at the bedside of the client with a chest tube in place? 1. A tracheostomy tray. 2. Another sterile chest tube. 3. A bottle of sterile water. 4. A spirometer. The correct answer is 3. A bottle of sterile water should be readily available and in view when a client has a chest tube, so that the tube can be immediately submersed in the water if the chest tube system becomes disconnected. The chest tube should be reconnected to the water seal system as soon as a sterile functioning system can be reestablished. There is no need for a tracheostomy tray, another chest tube, or a spirometer to be placed at the bedside for emergency use. A client who underwent a lobectomy and has a water-sealed chest drainage system is breathing with a little more effort and at a faster rate than 1 hour ago. The client's pulse rate is also increased. The nurse should 1. Check the tubing to ensure that the client is not lying on it or kinking it. 2. Increase the suction. 3. Lower the drainage bottles 2 to 3 feet below the level of the client's chest. 4. Ensure that the chest tube has 2 clamps on it to prevent air leaks. The correct answer is 1. In this case, there may be some obstruction to the flow of air and fluid out of the pleural space, causing air and fluid to collect and build up pressure. This prevents the remaining lung from re-expanding and can cause a mediastinal shift to the opposite side. The nurse's first response is to assess the tubing for kinks or obstruction. Increasing the suction is not done without a physician's prescription. The normal position of the drainage bottles is 2 to 3 feet below chest level. Clamping the tubes obstruct the flow of air and fluid out of the pleural space and should not be done. The nurse observes a constant gentle bubbling in the water seal column of a water-sealed chest drainage system. The nurse should 1. Continue monitoring as usual. This is expected. 2. Check the connectors between the chest and drainage tubes and where the drainage tube enters the collection bottle. 3. Decrease the suction to negative 15 centimeters H2O and continue observing the system for changes in bubbling during the next several hours. 4. Drain half of the water from the water seal chamber. The correct answer is 2. There should never be constant bubbling in the water seal bottle. Normally, the bubbling is intermittent. Constant bubbling in the water seal bottle indicates an air leak, which means that less negative pressure is being exerted on the pleural space. Decreasing the suction or draining part of the water in the water seal chamber will not reduce the leak. A client has a chest tube attached to a water seal drainage system, and the nurse notes that the fluid in the chest tube and in the water seal column has stopped fluctuating. The nurse should determine that 1. The lung has fully expanded. 2. The lung has collapsed. 3. The chest tube is in the pleural space. 4. The mediastinal space has decreased. The correct answer is 1. Cessation of fluid fluctuation in the tubing can mean one of several things. The lung has fully expanded and negative interpleural pressure has been reestablished. The chest tube is occluded, or the chest tube is not in the pleural space. Fluid fluctuation occurs because, during inspiration, interpleural pressure exceeds the negative pressure generated in the water seal system. Therefore, drainage moves toward the client. During expiration, the pleural pressure exceeds that generated in the water seal system, and fluid moves away from the client. When the lung is collapsed or the chest tube is in the pleural space, fluid fluctuation is likely to be noted. The chest tube is not inserted in the mediastinal space. When caring for a client with a chest tube and water seal drainage system, the nurse should 1. Verify that the air vent on the water seal drainage system is capped when the suction is off. 2. Strip the chest drainage tubes at least every 4 hours if excessive bleeding occurs. 3. Ensure that the chest tube is clamped when moving the client out of the bed. 4. Make sure that the drainage apparatus is always below the client's chest level. The correct answer is 4. The drainage apparatus is always kept below the client's chest level to prevent backflow of fluid into the pleural space. The air vent must always be open in the closed chest drainage system to allow air from the client to escape. Stripping a chest tube causes excessive negative interpleural pressure and is not recommended. Clamping a chest tube when moving a client is not recommended. Which of the following rehabilitative measures should the nurse teach the client who has undergone chest surgery to prevent shoulder ankylosis? 1. Turn from side to side. 2. Raise and lower the head. 3. Raise the arm on the affected side over the head. 4. Flex and extend the elbow on the affected side. The correct answer is 3. A client who has undergone chest surgery should be taught to raise the arm on the affected side over the head to help prevent shoulder ankylosis. This exercise helps restore normal shoulder movement, prevents stiffening of the shoulder joint, and improves muscle tone and power. Turning from side to side, raising and lowering the head, and flexing and extending the elbow on the affected side do not exercise the shoulder joint. When teaching a client to deep breathe effectively after a lobectomy, the nurse should instruct the client to do which of the following. 1. Contract the abdominal muscles. Take a slow, deep breath through the nose and hold it for 3 to 5 seconds, then exhale. 2. Contract the abdominal muscles. Take a deep breath through the mouth and exhale slowly as if trying to blow out a candle. 3. Relax the abdominal muscles. Take a slow, deep breath through the nose and hold it for 3 to 5 seconds. 4. Relax the abdominal muscles. Take a deep breath through the mouth and exhale slowly over 10 seconds. The correct answer is 1. The recommended procedure for teaching clients post-operatively to deep breathe includes contracting the abdominal muscles and taking a slow, deep breath through the nose. This breath is held 3 to 5 seconds, which facilitates alveolar ventilation by improving the inspiratory phase of ventilation. Exhaling slowly as if trying to blow out a candle is a technique used in pursed lip breathing to facilitate exhalation in clients with chronic obstructive pulmonary disease. It is recommended that the abdominal muscles be contracted, not relaxed, to promote deep breathing. The client should breathe through the nose. While assessing a thoracotomy incisional area from which a chest tube exits, the nurse feels a crackling sensation under the fingertips along the entire incision. Which of the following should be the nurse's first action? 1. Lower the head of the bed and call the physician. 2. Prepare an aspiration tray. 3. Mark the area with a skin pencil at the outer periphery of the crackling. 4. Turn off the suction of the chest drainage system. The correct answer is 3. This crackling sensation is subcutaneous emphysema. Subcutaneous emphysema is not an unusual finding and is not dangerous if confined, and the nurse should mark the area to detect if the area is expanding. Progression can be serious, especially if the neck is involved. A tracheotomy may be needed at that point. If emphysema progresses noticeably in 1 hour, the physician should be notified. Lowering the head of the bed will not arrest the progress or provide any further information. A tracheotomy tray would be useful if subcutaneous emphysema progresses to the neck. Subcutaneous emphysema may progress if the chest drainage system does not adequately remove air and fluid. Therefore, the system should not be turned off. Following a thoracotomy, the client has severe pain. Which of the following strategies for pain management will be most effective for this client? 1. Repositioning the client immediately after administering pain medication. 2. Reassessing the client 30 minutes after administering pain medication. 3. Verbally reassuring the client after administering pain medication. 4. Readjusting the pain medication dosage as needed according to the client's condition. The correct answer is 2. It is essential that the nurse evaluate the effects of pain medication after the medication has had time to act. Reassessment is necessary to determine the effectiveness of the pain management plan. Although it is prudent to check for discomfort-related positioning when assessing the client's pain, repositioning the client immediately after administering pain medication is not necessary. Verbally reassuring the client after administering pain medication may be useful to help instill confidence in the treatment plan. However, it is not as important as evaluating the effectiveness of the medication. Readjusting the pain medication dosage as needed according to the client's condition is essential, but the effectiveness of the medication must be evaluated first. After thoracotomy, the nurse instructs the client to perform deep breathing exercises. Which of the following is an expected outcome of these exercises? 1. Deep breathing elevates the diaphragm, which enlarges the thorax and increases the lung surface available for gas exchange. 2. Deep breathing increases blood flow to the lungs to allow them to recover from a trauma of surgery. 3. Deep breathing controls the rate of air flow to the remaining lobe so that it will not become hyperinflated. 4. Deep breathing expands the alveoli and increases the lung surface available for ventilation. The correct answer is 4. Deep breathing helps prevent microatelectasis and pneumonitis, and also helps force air and fluid out of the pleural space into the chest tubes. More than half of the ventilatory process is accomplished by the rise and fall of the diaphragm. The diaphragm is the major muscle of respiration. Deep breathing causes it to descend, not elevate, thereby increasing the ventilating surface. Deep breathing increases blood flow to the lungs. However, the primary reason for deep breathing is to expand alveoli and prevent atelectasis. The remaining lobe naturally hyperinflates to fill the space created by the resected lobe. This is an expected phenomenon. Which of the following would be a significant intervention to help prevent lung cancer? 1. Encourage cigarette smokers to have yearly chest radiographs. 2. Instruct people about techniques for smoking cessation. 3. Recommend that people have their houses and apartments checked for asbestos leakage. 4. Encourage people to install central air filters in their homes. The correct answer is 2. Epidermoid cancer involving the larger bronchi is almost entirely associated with heavy cigarette smoking. The American and Canadian Cancer Societies report that smoking is responsible for more than 80% of lung cancers in men and women. The prevalence of lung cancer is related to the duration and intensity of the smoking. So nurses can best prevent lung cancer by persuading clients to stop smoking. Chest radiographs aid in detection of lung cancer. They do not prevent it. Exposure to asbestos has been implicated as a risk factor for lung cancer. But cigarette smoking is the major risk factor. There are no data to support the use of home air filters in the prevention of lung cancer. Which of the following areas is a priority to evaluate when completing discharge planning for a client who has had a lobectomy for treatment of lung cancer? 1. the support available to assist the client at home. 2, the distance the client lives from a hospital. 3, the client's ability to do home blood pressure monitoring. 4, the client's knowledge of the causes of lung cancer. The correct answer is 1. Because clients are discharged as soon as possible from the hospital, it is essential to evaluate the support they have to assist them with self-care at home. The distance the client lives from the hospital is not a critical factor in discharge planning. There are no data indicating that home blood pressure monitoring is needed. Knowledge of the causes of lung cancer, although important, is not the most essential area to evaluate given the client's postoperative status. A client who underwent a left lower lobectomy has been out of surgery for 48 hours. The client is receiving morphine sulfate via a patient-controlled analgesia system and reports having pain in the left thorax that worsens when coughing. The nurse should 1. Let the client rest so that the client is not stimulated to cough. 2. Encourage the client to take deep breaths to help control the pain. 3. Check that the PCA device is functioning properly, and then reassure the client that the machine is working and will relieve the pain. 4. Obtain a more detailed assessment of the client's pain using a pain scale. The correct answer is 4. Systematic pain assessment is necessary for adequate pain management in the postoperative client. Guidelines from a variety of healthcare agencies and nursing groups recommend that institutions adopt a pain assessment scale to assist in facilitating pain management. Even though the client is receiving morphine sulfate by PCA, assessment is needed if she is experiencing pain. The concern is not to eliminate coughing, but to control pain adequately. Coughing is necessary to prevent postoperative atelectasis and pneumonia. Breathing exercises may help control pain in some circumstances. However, most clients with thoracic surgery require parenteral opioid analgesics in the early postoperative period. Although it is necessary that the PCA device be checked periodically to ensure that it is functioning properly, if the machine is functional and the client's pain is not relieved, further intervention, beginning with a pain assessment, is indicated. The nurse in the perioperative area is preparing a client for surgery and notices that the client looks sad. The client says, "I'm scared of having cancer. It's so horrible and I brought it on myself. I should have quit smoking years ago." What would be the nurse's best response to the client? 1. It's okay to be scared. What is it about cancer that you're afraid of? 2. It's normal to be scared. I would be 2. We'll help you through it. 3. Don't be so hard on yourself. You don't know if your smoking caused a cancer. 4. Do you feel guilty because you smoked? The correct answer is 1. Acknowledging the basic feeling the client expresses fear and asking an open-ended question allows the client to explain any fears. The other options dismiss the client's feelings and may give false reassurance or label the client's feelings. The client should be encouraged to explore feelings about a cancer diagnosis. A female client diagnosed with lung cancer is to have a left lower lobectomy. Which of the following increases a client's risk of developing postoperative pulmonary complications? 1. Height is 5 feet 7 inches and weight is 110 pounds. 2. The client tends to keep her real feelings to herself. 3. She ambulates and can climb 1 flight of stairs without dyspnea. 4. The client is 58 years of age. The correct answer is 1. Risk factors for postoperative pulmonary complications include malnourishment, which is indicated by this client's height and weight. It is thought that emotion responses can affect overall health. However, not verbalizing one's feelings is not a contributing factor in postoperative pulmonary complications. The client's current activity level and age do not place her at increased risk for complications. The nurse has assisted the physician at the bedside with insertion of a left subclavian, triple lumen catheter in a client admitted with lung cancer. Suddenly, the client becomes restless and tachypneic. The nurse should 1. Assess breath sounds. 2. Remove the catheter. 3. Insert a peripheral IV. 4. Reposition the client. The correct answer is 1. The nurse should first assess for bilateral breath sounds since a complication of central line insertion is a pneumothorax, which would cause an increase in respiratory rate and drop in oxygen, causing irritability. The nurse should also assess blood pressure and heart rate for the complication of bleeding. A chest X-ray will be performed to determine correct placement and complications. A central line was most likely placed because peripheral IV access was not available or adequate for the client. Repositioning may be considered after assessments are done.
You can get my NCLEX review bundle. Links will be in the description. I'll see you guys in the next video.